Hi everyone, welcome back to the channel. Today I'm reacting to episode 2 of Junior Doctors, the TV show on BBC. I did episode 1 about 2 years ago. Better late than never, so let's get started. I'm watching on my laptop here. I used to love this show. I watched it a lot during medical school and even before I went to medical school. I just found it so inspiring.
I almost walked away. I'm buzzing.
I remember the joys of finding out that you're working Christmas. The rota is released at the same time to everyone. I remember just waiting with bated breath.
With many of the doctors and nurses on holiday, any staff on shift today will have their work cut out.
That's true.
Morning.
To help with everything, you do get a lot of cakes, chocolates, just to get you through the night. So that's quite nice.
There's no shortage of Christmas goodies to keep them going.
Yeah.
Have you noticed how much food there is on all the walls?
Honestly, people just keep like freaking it in. Could have no teeth on.
I went to the gym this morning.
Interestingly, I had the most chocolates, donuts when I was on CCU, so the coronary care unit on cardiology, which is a bit of an oxymoron, I think. The jobs list
And
the
with
bleep.
staff away for Christmas, her job list increases.
All the blood's taken by the phlebotomists in the morning. Because it's Christmas, there's no phlebotomists on, so we have to take all the blood today.
The same thing happened to me when I was on calls over Christmas. Our IV nurse was off as well. She used to do bloods and cannulas, but when they're not there, like over the Christmas period, the bleeps just never stop. The bleeps never stop.
Over in A&E, Christmas can mean more patients coming in with alcohol-related injuries than usual.
That's very true.
I've had a couple of drinks, went out for a smoke, and that's it. Hello.
Michael has fractured his ankle and dislocated it on one side, causing him severe pain.
Oh my god, I'm really sore. I'm really sore. Really sore.
His bones need to be put back into place. It's the first time Tom's done this procedure and will be overseen by senior colleague Lucas.
Bit of gas in air there, just to make it a bit more bearable.
Just don't be scared. You can't do it too hard.
Just you, bro.
Okay?
You do see a lot of alcohol-related injuries around the festive period. Sometimes it's minor injuries, lacerations, so you clean them up, and sometimes you just allow them to slip it off, some fluids, and then they get up in the morning, thank you, and then they go home.
Whilst cracking bones might not faze the A&E team, there are things that make our junior doctors squeamish.
This is a bit of an issue because I want to be an anaesthetist, but I really hate it when people put injections underneath the skin.
I don't know.
It goes right through me.
I'm not a particularly big fan of examining people's feet. There can be things wrong with them, ulcers or things like that. They're not really nice to look at or even smell.
I've always had a thing about cut fingers. Do you know what I mean? But I haven't had to deal with that on any yet.
I feel like everyone's got a thing, right? For me, it's injections. Very happy to give an injection, but receiving injections, even vaccinations, I'm like, can someone hold my hand, please?
I never thought I had a problem with snot until the first time I took a lump as big as my fist out of someone's nose. That was really disgusting.
I just find skin so bizarre. I literally hate skin. I don't know why. I've had no horrific experience with skin. Skin's never done anything bad to me, but I just don't like skin.
Skin is an interesting one.
Haura is once again answering the bleep.
As an F1 covering the ward, you could get a bleep saying cardiac arrest on one side of the hospital and be called to something minor like prescribing paracetamol for a patient on the other side of the hospital. So you never know what can come through the bleep.
So
It could
you
be
get
anything.
in with an overdose.
An overdose of... We
We
don't
don't
know.
know, no.
Do we think he's delirious? Is
Yeah,
that why?
I think he's hallucinating.
Okay, fine.
He's saying like he's lost his 20 quid, can't find his jacket, but he doesn't have any of these things.
Okay, fine.
Overdoses where you don't know what someone is taking can be a bit of a challenge. I saw a few when I was in A&E. If you know what medications they're on, that can help because you can then try and work out, what that medication does and some of its side effects, because then that's what you would see if someone is taking a lot of that medication. So, for example, if it's a blood pressure tablet and you've taken a lot of it, then your blood pressure will be quite low, sort of thing. And then you can combine that with doing like a toxicologist screen. That will give you some more information.
There's no one outside.
So he was found unconscious by ambulance staff. He came in with 2 police on recall for prison for a previous assault. I was on this ward earlier reviewing another patient and I heard him being very loud and aggressive, and if you're walking into that kind of situation, you're going to be anxious about it.
Yeah.
Day one, you thought you were going to save a life. Day one, you thought you're going to do something crazy, do something dramatic or something like a superhero.
Nope.
Instead, geriatric medicine deals with patients that are elderly and frail and vulnerable, or even patients that have delirium or dementia.
I can't understand the way I feel sometimes.
Sometimes it's about optimizing their situation but not being able to kind of treat or cure it.
Especially on care of the elderly medicine, there's a lot of social planning that goes into it. You're not doing some fancy medicine, but you're doing a very important job.
We've just come to pop a cannula in because you need to have your medication through your veins. Anaesthetics is one of the most kind of more practical specialties. They are the masters of clinical skills.
With doing bloods and cannulas, usually if there's someone watching you, it's not going to go well. Let's see what happens here. Generally speaking, you can get like 100 in a row.
Yeah, it appeals to me so much.
Someone's watching you or you're teaching a medical student. Can't get it in.
It's a skill he'll need to perfect to follow his dream of becoming an anaesthetist.
I know it's difficult, but could we just try and stay as still as possible?
I'm still.
I know, it's not. It's easy when I'm stood here on the other end.
Where were you born?
I was born in Manchester.
Manchester.
Nick's only allowed to make 2 attempts.
Oh,
if he
man.
fails, he'll have to alert one of the senior doctors.
I think he might have wiggled away from us, this. Can we have one more look? Would that be alright?
You can look as much as you want.
Sorry, we're just having a little bit of a hunt for it.
When you put in a cannula, you know you're in the vein because it gives you a bit of flashback of blood. That's like gold dust when that happens. He's not getting any flashback and your heart just sinks. You're like, ah. And you feel sorry for the patient as well because maybe this is your second attempt and you have to get someone else.
What we might do is just give you a little bit of a rest and then we might come back and see you.
Nick's failed on the second attempt. He now has to refer the job up to a more experienced doctor.
But a lot of patients actually know when they're difficult, and you'll walk in with your cannulas
I'm just here to do those bloods.
and they'll be like, oh, good luck. Oh, what does that mean?
I think your veins are quite deep, aren't they? There are some tricky ones. There are some veins that like to run away from you.
I think every...
I call them wrigglers. I was like, oh, we've got a wriggler here. AKA, I'm struggling.
When you are there kind of struggling to fit in a cannula, you can just see the patient staring at you thinking, what are they doing?
It's not bleeding back.
So that bleeding back she's talking about, that's that flashback I was mentioning earlier. If you don't get that, it's just a heart sink moment.
There's nothing worse than when you call the anaesthetist saying there's this person that no one could put a cannula in and they just come and throw it in from the end of the bed.
There we go.
They literally do as well. You're just like, I look there, I couldn't see anything or feel anything. He's great, he's great.
¿Cómo está ahí? ¿Dolor?
No.
No. The heart? Banga.
Arturo decides a crucial conversation is needed with her son about when to stop treating her. Making the decision to not attempt resuscitation is a difficult thing to talk about and an important skill for Zahaib to learn.
So what they're talking about there is talking about the respect form. They used to be called DNA CPR forms, but actually there's quite a lot more to it than just talking about the CPR bit. It's talking a bit more about the person as a whole, you know, what their wishes would be, what they would want to happen in certain situations, and making a plan for the future. And it takes into account things like lasting powers of attorney and stuff like that. But yes, certainly it remains a very difficult conversation to have.
We're trying to essentially tell family member what's going to happen to their dad or their mom, and sometimes it's about not doing much for them and kind of preparing them for this final chapter of their life. It's important to understand that sometimes the family is very upset with these discussions.
Yeah, it's very true.
If you don't know how to have these difficult decisions as a physician, then you're not a good physician. So you do definitely need to develop these skills if you're going to take care of patients who are likely to die.
Nick's just started an on-call shift where he'll be responsible for all 55 of the department's beds.
I've been super busy. I'm coming to it. Look.
Yeah, on-call is when, especially as a newly qualified junior doctor, on-call is when you really practice that medicine. Especially if it's really busy, you're going to be getting double bleeps and bleep to say, where are you? And you're looking at your jobs list, which is just pages and pages long. Whew.
I'm busy. It's potentially starting to turn into a busy, but we're just getting the edges now.
You keep going.
Nick's been asked to put his cannulation skills to the test.
I'll come have a look at it. Whether or not I'll be successful is another story. I'm not sure we're going to be successful here.
Shame.
Very sorry.
No flashback.
No problem.
Let me go and see if I can get my hands on this Fain Finder because I've used it before and it brings up things that you would never even dream about seeing.
A Fain Finder.
Bloody list broke.
Ah, AccuVein saved my life a lot on obs and gynae, because on obs and gynae they want the bigger end of cannulas, you know, the greens, the greys. Whew. Good old AccuVein. It sort of highlights where the veins are, but it doesn't tell you how deep they are. So you just sort of go on feel and just look for that flashback.
Right, so what I'm going to do is, I don't think we're going to have much luck here. I'm going to call one of the other doctors and see if they, because what they might need to do is if they complete an ultrasound. That might be an idea. That was difficult, I suppose, in the sense that it was just more my own pride more than anything else.
That's true. It does get you down. You're like, I've not managed to get one in the last 3 days. Like, what is going on? Have I lost the skill? What is going on?
Haura is doing a medical on-call shift and must visit a recently deceased patient. Certifying a death is a job our junior doctors will inevitably be required to do in their career.
Hi, it's Haura Medical F1.
And for Haura, it's her very first one.
It's really something that I was taught how to do in medical school.
Yeah.
And
Confirming death. Everyone will remember their first time they confirmed death. It's something you're taught in medical school. You know the procedure, the steps you need to take. But for that very first time, when you listen to someone's chest and you can't hear a heartbeat, you can't hear breath sounds, it's just silent. Nothing really prepares you for that.
I think I'm going to take my time with it and I'm going to reflect immediately afterwards.
Yeah.
And then get on with the rest of my day.
Yeah. You kind of have to do that because it's one of those things that, especially on an on-call shift, you do that and afterwards you still have a list of jobs to do and more blips will be coming in. So reflecting on it and then moving on is all you can do afterwards.
Brought into A&E by her husband after complaining of nausea and tightness in her chest.
Found out when I was 39 that I had a hole in my heart, and I even came in just like this with the same symptoms, with my fingers swelling, dizziness, heart palpitations. After the operation, I was in the heart care unit for 2 weeks with inflammation and infection of the lining of the heart.
So what she's describing there is pericarditis. So the heart sits in a lining that sort of protects it, and that can get inflamed, and that's pericarditis. She was describing a hole in the heart. I suspect she's probably describing a patent foramen ovale, which is a hole between the top 2 chambers of the heart, which is the atrium. I would imagine if it was a hole between the ventricles, the bottom 2 chambers of the heart, that would have presented itself a lot earlier in childhood, essentially, because that would make you quite unwell.
Yeah, and a collapsed lung. I'm a massive A&E regular. Because of that one time, and I don't listen to the symptoms and don't listen to my body. It might be that time.
Difficult place to learn. Send someone who's got something serious. You're saying they're well. It's life or death.
With Sean's x-ray complete, Tom discusses the results with another A&E consultant, Martin.
She said she had a heaviness over her chest, which has been getting worse over the last few days. But she also says that when she takes in a deep breath or when she coughs, she gets a sharpness.
Well, her ECG's normal and her CRP's normal.
I feel like, and that's what they're doing there, is just to make sure you've excluded anything serious that could be going on, especially with a patient with that kind of history.
Having a look at your chest x-ray and the bloods that we've got so far, it's all normal. But there's no real reason, I guess, to keep you in. The thing that's going to give you some answers is this scan of your heart. The plans are already in place for that, which is good. So I guess we'll get you home. Is that okay?
Yeah, that's great. Yeah, it's good. It's reassuring.
Exactly.
Despite her ongoing health problems, Tom is able to send Sean home while she awaits her scheduled cardiac appointment.
If you haven't watched me react to episode 1, I'll leave it linked down below and up here somewhere. Thank you very much for watching. I'll see you in the next one.